You'll notice in media reports and in interviews with advocates of the affirmation model, when they are discussing puberty blockers and cross-sex hormones in children, they will report a 1% regret rate. This claim is made by referencing two studies, neither of which is applicable to children and adolescents taking puberty blockers and cross-sex hormones. The first study is from the Dutch clinic and was published in 2018. The researchers looked at the medical records of all the people seen at their clinic between 1972 and 2015. This was a retrospective medical record review. They looked at the medical records of 6,793 subjects. Roughly 2/3 were male. In order to be considered someone who had regretted their transition in this study, the subject had to have undergone a gonadectomy and then returned to taking the hormones of their natal gender. They had to have told the clinic about their feelings of regret, and those feelings had to have been documented in their clinical file. Most of the subjects in this study had transitioned as mature adults. The group of adolescents in this study is small, and they had a shorter duration of follow-up because the number of adolescents presenting to the clinic with gender dysphoria only started to increase in 2015, shortly before the study finished. And we know that the adolescents undergoing the affirmation model through the clinic at that time were a highly selected group with early childhood onset gender dysphoria, no psychiatric comorbidity and supportive families. 36% of eligible people had dropped out of attending the clinic and so did not have data to be included in this study. The study identified 14 people out of 6,793 people who reached that very high bar to be classified as a regretter, and their regret was expressed on average 10 years after their transition. We know that regret is a complex emotion, and this study has an incredibly high bar to reach to be considered a regretter. Using this criteria, Kira Bell would not be considered a regretter as she did not undergo gonadectomy. Corinna Cohen would not be considered a regretter because Corinna has not decided to take testosterone. The other study that is used to claim a 1% regret rate for adolescents treated with the affirmation model is a study published in 2021 by Valeria Bustos and her team. The researchers combined the results of 27 studies to form a group of 7,928 subjects who had undergone any type of gender affirmation surgery. The subjects were 2/3 male. Almost all studies were of poor and fair quality using the National Institute of Health Quality Assessment tool. The studies had high rates of losses to follow-up and did not use valid assessment measures. Follow-up times were variable, with some studies having a very short follow-up. The subjects were mostly adults. Only 5 studies, representing just 3%, or 174 of the participants, received higher quality ratings. However, even these had losses to follow-up rates ranging from 28 to more than 40%, including loss through death from complications of surgery or suicide. The authors overlooked numerous relevant studies, including one of the best known, raising questions about the adequacy of their search strategy. One study was inappropriately included in this study as it only investigated regret regarding choice of surgical procedure, not of surgery itself. There were significant data extraction errors leading to erroneous conclusions. For instance, the sample in the largest included study was incorrectly inflated from 2,627 to 4,863, likely due to a miscalculation from a table. The cohort presenting with gender dysphoria today is substantially different from the cohort presenting during the research periods of the included studies, which were from the late 80s and 90s. The pooled prevalence of regret after gender-affirming surgery was found to be 1%. Modern cohort of patients had a shorter follow-up time.